Lung volumes and capacities, with the exception of the residual volume, functional residual capacity, and total lung capacity, are measured with a spirometer. Most spirometers used today are computerized systems that utilize a differential pressure transducer to make measurements that are converted to volumes and flows. These volumes and flows are then displayed on a computer monitor in text and graphic form. The individual pictured here is undergoing a spirometry test. Wearing nose clips, she makes a tight seal with her mouth on the mouthpiece. The technologist then instructs her in performing a variety of maneuvers that will result in the measurement of the lung volumes and capacities. Typically, the patient will be instructed to breathe normally and then to take a deep breath all the way in. She will then be instructed to exhale completely. This can be done slowly for a slow vital capacity measurement or rapidly for a forced vital capacity measurement. Lung volumes and capacities are measured using a slow vital capacity maneuver, while airflows are measured using a forced vital capacity maneuver. Pictured here is the spirometry tracing showing all four lung volumes: tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume, as well as all four lung capacities: inspiratory capacity, vital capacity, functional residual capacity, and total lung capacity. We will discuss each of these separately. The tidal volume is the amount of gas an individual inspires or expires during normal, quiet breathing. So as you sit there breathing normally, in and out, that's your tidal volume. Normally that volume is 3 to 4 mLs per pound or 7 to 9 mLs per kilogram of ideal body weight, which is about 8 to 10% of the total lung capacity. The inspiratory reserve volume is the amount of gas that an individual can inhale above a tidal inspiration. So as you're sitting there and you make a normal tidal inspiration and then take a deep breath all the way in as far as you can, that's an inspiratory reserve volume. Normally, it is 60% of the total lung capacity. The expiratory reserve volume is the amount of gas that an individual can exhale beyond a tidal expiration. So as you're sitting there and exhale normally, and then push all the gas out that you possibly can, that's your expiratory reserve volume. Normally, it is 20% of the total lung capacity. The residual volume is the amount of gas remaining in the lungs after a maximal expiration. So as you're sitting there and you blow all the way out as far as you can, the amount of gas that remains in the lungs is the residual volume. Normally, it's 20% of the total lung capacity. The residual volume cannot be exhaled, so it cannot be measured directly with spirometry. The inspiratory capacity is the amount of gas that an individual can inhale starting at a tidal expiration. So as you breathe out normally and then take a big deep breath all the way in, that's the inspiratory capacity. Therefore, it includes the tidal volume and the inspiratory reserve volume. You might take an inspiratory capacity before jumping into the water so that you can stay underwater longer. Normally, it is 60% of the total lung capacity. The vital capacity is the amount of gas that can be exhaled after a maximal inspiration. So what you would do is take a big deep breath all the way in and then blow it all the way out as far as you can, and that would be a vital capacity. Therefore, it includes the inspiratory reserve volume, tidal volume, and expiratory reserve volume. The functional residual capacity is the amount of gas remaining in the lungs after a tidal expiration. It includes the expiratory reserve volume and the residual volume. Normally, it is 40% of the total lung capacity. The FRC cannot be measured with spirometry because the RV cannot be exhaled and therefore it cannot be measured directly. The FRC has to be measured indirectly using helium dilution, nitrogen washout, or body plethysmography. The total lung capacity is the amount of gas in the lungs after a maximal inspiration. So if you take a big deep breath in and hold it, the volume of gas in your lungs is the total lung capacity. Therefore, it includes the inspiratory reserve volume, tidal volume, expiratory reserve volume, and the residual volume. Normally, it is about 6,000 mLs for adult males and 4,200 mLs for adult females.